The United Steelworkers have fought a long, hard battle for decent working conditions and just compensation. But as you know all too well, that fight is never done. Today, in boardrooms across America, our benefits are under attack. We're asked to pay more, to accept larger deductibles, and sometimes to place our health and well-being into the hands of medical providers we know little or nothing about. It's an issue of vital importance to the Steelworkers Union because it has far-reaching implications, not only for us, but also for our wives, husbands, and children. The Steelworkers Health and Welfare Fund gives us a way to protect ourselves from disturbing trends in the healthcare industry.
We knew that Rubbermaid was coming after us with major cuts in our insurance. We knew that it was going to be a strike issue in our 1996 negotiations. Fortunately, the Steelworkers Health and Welfare Fund were able to bring trustees into our negotiations and actually negotiate a better plan than what Rubbermaid had originally had, and it actually saved the company money in the long run too.
The Steelworkers Health and Welfare Fund is a comprehensive benefit package managed by the USWA for its members. This is a totally union plan, and it's your plan.
Unlike many company policies which are driven by cost considerations, the fund is based on people's needs. Using quality as a primary consideration, the union negotiates excellent coverage from Blue Cross Blue Shield and other reputable providers. Employers pay the fund for this coverage, and we oversee the plan on your behalf.
I have 1,200 workers that belong to this program. They're all satisfied and happy with the program. They're satisfied with the benefits of this program. And then, like I said, we resolve the problems at the union hall. This is our program. Nobody else's program but ours. We control it. We control the activity of it. We control the cost of it. And the company can't just throw figures at us and try to increase those costs without justification.
The Steelworkers Fund offers several health care and benefit options, ranging from tightly managed cost containment programs to highly flexible plans.
Managed care medical coverage is offered either as point-of-service care coordinated through a primary care physician or within a preferred provider organization. For those who want more traditional coverage, there's also fee-for-service medical benefits. An optional prescription card program and dental and vision expense plans can be added to medical coverage. There are also attractive rates on short-term disability and life and accidental death and dismemberment policies. In the Steelworkers Fund, quality coverage comes with full service, including a toll-free information number and complete plan documentation.
The coverage and the service have been very well handled through the Health and Welfare Fund. Anytime we call and need assistance, there's always somebody there ready to help us.
The Steelworkers Health and Welfare Fund is growing. With 30,000 members, you get excellent coverage at low cost. This plan offers more benefits for less money than many employers, particularly small ones, are able to obtain. As a result, the fund is a powerful tool for maintaining benefits through collective bargaining.
I had a small company, 7 employees. When we sat down to do their proposals, it was the first time I sat in their contract negotiations, and I realized that they didn't have a major medical, and I couldn't believe it in this day and age. And I knew to propose the same health care they had with a major medical was going to be extremely costly. When we got the cost from the employer, what the health care plan cost, we realized we could do the Steelworker Health and Welfare Plan for as little or a little bit more, and they would have full coverage of major medical and a prescription plan, and it would be beneficial to our members.
The Steelworker Health and Welfare Plan is policy of the International Union. It's been endorsed by the International Executive Board, and it's been endorsed by the last two International Union Conventions, so that makes it policy. We wanted to make the plan policy because it really provides a tremendous opportunity for the union to get involved in the negotiation of health care in a very meaningful way. We're able to bring leverage of a large group to the bargaining table with the provider so that we can get the best benefits for the lowest cost, while at the same time giving an alternative to the corporate approach of simply trying to cut benefits and shift costs to our members, so that the health and welfare plan provides a really useful collective bargaining tool, as well as providing really good health care benefits.
We're the only Rubbermaid plant in the United States that's organized, and in comparing plans, Rubbermaid has went to a 60-40 plan throughout the rest of the country, so we're basically at a 90-10 with much better benefits than the other facilities.
The Steelworkers Health and Welfare Fund is just one more way we can find strength in solidarity. Another way your union is working to improve the quality of your life. Don't let employers cut back on your benefits unnecessarily. Bring your health plan, the Steelworkers Health and Welfare Fund, to the negotiation table.
All right, in the state of Ohio, we have approximately 75,000 steelworkers. And with numbers, there's clout. And with clout, there's power. We want to organize all these members into the Health and Welfare Fund, because with that grows strength, grows power, and be able to increase more benefits and reduce costs. And that's our goal.
Because the Steelworker Health and Welfare Plan provides such a tremendous tool at collective bargaining, it's really important that our staff and our local union bargaining committees, prior to making their determinations of what their priorities will be in bargaining, that they sit down, look at the health and welfare program, feel and figure out if it can help them. If it can help them, which we believe it can, then to work with the health and welfare staff, put a proposal on the table, defend it, and fight for it. It's the Steelworker Health and Welfare Program. The reason it's the Steelworker Health and Welfare Program is it's designed to help our members.
Take a stand for the Steelworkers Health and Welfare Fund. Put your benefits in the hands of the people you know you can trust.